Now we're going to see Clostridium difficile. Clostridium difficile is a gram-positive rod that produces the colitis or pseudomembranous colitis. Could be just colitis, pseudomembranous colitis, or just the watery diarrhea. The pathogenesis is Clostridium difficile produces a B toxin. This time the B is not for binding. The B is a cytopathic toxin or component of the toxin that is the one that produces the destruction of the cells. Actually inhibits the polymerization of actin, and the A toxin produces damage to the mucus and leads to attractment of the neutrophils. Disrupts the cell membrane of the red blood cells, platelets, leukocytes, leads to bradycardia, hypotension, and shock. So this is a very serious condition. The treatment is with vancomycin, pyroximina, or metronidazole, and in the worst case is a fecal transplant. The condition arises from over-treatment with antibiotics, that is, we give some antibiotic that destroys the normal flora of the GI tract, but do not destroy to Clostridium difficile. Clostridium difficile is part of our normal flora, but we don't have very much Clostridium difficile. But if we inhibit the growth of the other bacteria in the GI tract, Clostridium difficile can proliferate and so now initiate the infection. The antibiotics that are associated with producing the Clostridium difficile infection are penicillin, clindamycin, sometimes some fluoroquinolones, and aminoglucosides like tobramycin. And the inhibitors, the proton pump inhibitors for reflux or treatment of Helicobacter pylori. The diagnosis is with detection of the antigen, or PCR for the toxin.